Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Rowena Sigler. Rowena is a physical therapist. In the past 13 years, Rowena has had experience at skilled nursing facilities and in outpatient and home health care settings. Rowena now specializes with patients in ICU early mobility settings here at Washington Hospital.
Hi, good evening.
Good evening.
Thank you for coming. My name is Rowena Sigler. I'm a physical therapist for almost 13 years now. I have worked in different kinds of settings. I work in a skilled nursing home, outpatient. I have done home health, and right now I'm working in a hospital. So that's my focus right now, and I have been working on mostly early mobility in the ICU setting. So when it comes to patients and seeing the different kinds of people out there, I have seen and been in different situations in having different settings and different patients to deal with. And like I said, like she mentioned right now, I'm even experiencing one of the things that you guys or everybody else would probably feel, which is what they call vertigo. It's an balance problem. Anyway, so my talk today is strategies for incorporating physical activity into your life when you have complications from diabetes. So what we're going to talk about, the benefits of physical fitness, screening and precautions, complications, modifications or strategies, and exercises. So it's not as simple as when you decide to say, okay, today I'm going to go out there and do some exercise. When you have diabetes and you have some of the complications, it's not as easy as going out and running like everybody else can do. So those are the things that we would focus on and try to realize what are the challenges that are out there and how can we fix it. So everybody knows the benefits of exercises are always good. Benefits of physical fitness can be defined in terms of strength, endurance, relaxation, flexibility, and balance. One of the reasons why I put that up is to show you that there are different ways that you can strengthen yourself. When you say physical fitness, it doesn't necessarily mean just getting stronger. It doesn't necessarily mean just doing flexibility. It could be different areas. So you can focus on different areas depending where you are at your illness. Aerobic conditioning exercises, weight loss, maintenance of body weight, and it has an independent effect of lowering your HbA1c unrelated to weight loss. So those are the things that you can also, on the side, affect if you pick up physical fitness, if you start doing some regular exercise regimen. So for physical fitness, the HbA1c level reflects an average blood glucose level over the past 2 to 3 months. For the A1C, I'm not going to focus much on this. We're just going to touch on it. But the fact that we recognize that it's there and it's one of the challenges and it's one of the side effects that we can get as a benefit when we're doing exercises. So people without diabetes, the average should be below 4.5 to 5.7. And then the people with prediabetes, A1C range is 5.8 to 6.4%. The A1C is becoming one of the normal things to test if you're pre-diabetic. So if you're going to your doctors, that's one of the common terms that you would hear, and one of the things that they would use to diagnose you with diabetes. Target the A1C is your blood glucose level. They're gonna check it, and then they're gonna say where you are at. So if you have 5.8 to 6.4% when they do the blood test, then they would say you might be pre-diabetic. So it's almost gonna be like, okay, this is your wake-up call. Let's do something about it. And then the target A1C for those who already have diabetes is below 7.0 in order to prevent complications. So when you do your exercises, it affects the A1C range. And that's why it's one of the things that we would touch on. Anything that every time you start any exercise regimen, you always want to make sure that your doctor knows about it, especially if you do have the complication of diabetes. This is what's recommended to reduce your cardiovascular risk is 150 minutes a week with the intensity of at least 60% of your VO2 max. Your VO2 max is what your heart can do at the high, it's called maximum, your age minus 220 minus your maximum heart rate. So when you do any exercise to have that effect, it has to have your heart beating a little faster. If you're doing your exercise and it's just like your daily walk, it's not a brisk walk, it won't have the same effect as if you were challenging your heart rate. So that's why the VO2 max was mentioned. And it should be distributed over 3 to 4 days per week, no more than 2 consecutive days. For any exercises, we usually recommended 3 to 5 times a week. There's always 1 day interval because you want your body to recover the next day. Usually when you start any exercise, you feel the effect of it after, the day after, not that same day. Some of it would be the day after. That will give you a gauge whether what you're doing is just right or too much or too less. So you always want to do an exercise and give 1 day rest in between. So what we call moderate to vigorous exercise is exercise that again, your VO2 max is exercise that makes you breathe hard and perspire. It raises your heart rate. So that's where you want to be when you do your peak time, meaning you have to start with a cool warm-up for 5 minutes, and then you want to get that peak where you're perspiring and your heart rate, you can feel a little bit of your heart rate. So there's such thing as we call a talk test. A talk test meaning moderate physical activity, you can still talk to the person next to you. So a vigorous activity means person cannot talk without pausing your breath. So when you're walking and you feel yourself going this, and then you have to grasp, so that's your peak activity area. So that means that's where you want to stay for a few minutes and then start your cooling down. So usually exercise is about the intensity, where you want to be in the intensity is 30 minutes. So you have 5 to 7 minutes of warm up, and you want to leave in the end another 5 to 7 minutes of cool down. So 30 minutes of vigorous exercise, and then you have your 15 minutes for your warm up and cool off. Aerobic training. The benefits is for high blood pressure, to lower your HDL, and for high triglycerides. So again, all these things is exercises that you would do if that exercise is your target. So earlier, the first slide is for your heart, cardiovascular, and this one is for aerobic training. So you want to build up your endurance. And then you have your resistance training, which again, for resistance training, those are your weights. If you want to start doing you can start with a 2-pound weight, and those are the ones that you would promote the muscle strength and muscle endurance. And also 8 to 10 exercise involving major muscles, minimum of 1 set of 10 to 15 reps to near fatigue, progressing 3 sets. So your big muscles are your shoulder, your hip, your knee. So you want to start with those muscles doing your exercises. So you have your biceps curls, you have your leg raises, and you can do all those things. And then your flexibility is stretching. So when you do a flexibility exercise and when you're doing any stretching, you want to maintain the position for 30 seconds. You have to hold it to get that stretch at the end of the range. So if I'm going to stretch, for example, my biceps, and I'm going to hold it for 30 seconds, okay? And then I'm going to relax. That's going to be for flexibility. And then for balance, what we call the vestibular exercises and Tai Chi, your yoga, your Pilates, those are the things that you can do. And most of the community have their senior programs. I just got one in the mail. And a lot of them offers this Tai Chi, yoga, Pilates. And it would help with some of the flexibility, and it's not as strenuous. So if you want something to do more with flexibility, those are the ones that are recommended. So now before you start any exercise regimen, we have to check for the complications that we were talking about. So we would check for nephropathy, retinopathy. I would discuss each one. So the nephropathy and retinopathy are both sensitive to blood pressure. So if you're diagnosed with a diabetic nephropathy, this means that one of the things that your doctor would check is if you have your urine, if you have protein in your urine. So that means that for the healthy looking urine, the urine flows out and clears out all your protein. But with this one, there's some leak on it. And this is what happens if you have diabetes and you've had it for a while. So if you have that one of the symptoms that would trigger that is that you have blood in your urine, you have increased cholesterol and triglycerides, or a foamy urine, or swelling. And to prevent that, you have to maintain your blood pressure less than 130/80, limit your protein and salt intake, and quit smoking and drinking. So, and what do they mean by it's affected by blood pressure? So when you're doing any exercises, you want to make sure you want to start with checking your blood pressure. You want to maintain your blood pressure at a certain level so it doesn't trigger this diabetic nephropathy. And that's why they were saying that the nephropathy and retinopathy are both affected by your blood pressure. So those are the ones that we just mentioned about the symptoms. And then so one of the things is you have to avoid weightlifting over 70%. So that means you always start with the low pounds. For example, you just start with 2 pounds when you're doing your exercises. And you avoid Valsalva maneuver. Valsalva maneuver is when you bear down, you hold your breath and you bear down and you go. If you're lifting something heavy or you're pushing something heavy, most people will go hold their breath and push down. That puts your blood pressure actually up when you do that. So one of the things that happens too when you do that, you get dizzy because you're holding your breath and you're pushing down to get something off the floor or you're lifting something. And that's why they were saying that they're recommending not to carry so much weight that would really trigger that for you to hold that weight. You're trying to carry 25 pounds and you have to do that Valsalva maneuver just to get it off, your blood pressure will go up. So those are one of the things that you're not supposed to do. And then with diabetic retinopathy, these are vision challenges that we're talking about. So what happens is that you have tiny vessels of the eye which are prone to damage, usually both eyes. So these are the different vision challenges that we can encounter. Glaucoma is the increased fluid in the eye that causes optic nerve damage, and cataract is clouding of the lenses. So for example, this is the normal vision, and this is what a cataract person would see. This is how it would look like. And this is if you have diabetic retinopathy. So for those complications with retinopathy, you want to avoid jarring motions of the head. So for example, what you mean by jarring is like the abrupt motion. Like if you're gonna just almost like what would be described as like whiplash, where your head is changed from one position to the next abruptly. And holding the breath puts pressure on your eye as well. So those are the things you want to avoid. Putting your head below the waist or increasing your blood pressure, systolic blood pressure to 30 millimeter per mercury from resting systolic blood pressure. So for cataract and glaucoma, when you wanna do your exercise, you wanna make sure you go to a well-lit area because of that cloudiness and that challenge in your vision. You wanna make sure when you're doing any exercises, everything on the floor as well is clear. So you wanna eliminate as much as possible things that would make you fall, things that would off-balance you because of the challenges on your vision. Autonomic neuropathy. So this is one of the things that it affects your whole body. So it would affect your function in your blood pressure, heart rate, and sweating. It affects everything from respiratory, gastrointestinal, cardiovascular. It affects so many things that if you are diagnosed with that, oftentimes when you do an exercise or when we tell you to do any activity, the normal reaction for heart rate and blood pressure is to go up because you're being challenged. But with them, what happens is that it stays the same, which we call blunted response. So your heart rate and your blood pressure stays normal. So if you're 90/70 right now, and I ask you to do some jumping jacks, your next person might be 120/80, you're still 90/70. And that's caused by your autonomic neuropathy. So one of the things that we tell our patients is that you try to do the dyspnea scale. So this one tells us, for example, if you're working with a therapist or you're working with an athletic trainer, it tells you by your feedback, how hard is the exercise that I'm doing? So you want to stay between the number 4 and 5. So just here. The 4 and 5 is when you would hit your target heart rate. That's when you're challenging your body to go as much as it can without having to go to any other serious complication. So you want to go to 4 and 5. This would be a more reliable gauge on how you're doing your exercise as opposed to checking your blood pressure or your heart rate if you have that autonomic neuropathy. So also some medications also gives you that kind of result. And this is another one for respiratory. So a dyspnea scale. So it tells you how hard is it what I'm doing. So if I'm doing another exercise and I'm asking you, well, I recommended that you do a 2-mile walk in 5 minutes. So then you're going to tell me, well, how hard was it? Was it a number 4 or number 5? Or was it number 7 by the time you reach the 2 miles? So then it will tell us together if what you're doing is too much or too little by that kind of scale. As opposed to me I won't be there to check your heart rate. You won't be able to check your heart rate or your blood pressure. But this one gives you a feedback right away. How hard is the exercise I'm doing? Or how little am I doing? If I'm challenging my body enough or not. So now we go to foot complications. Most diabetes patients have foot complications. So sometimes it starts as a callus, and then it builds up. One of the things that every time you do any exercise for diabetes is you want to check your foot. The most common complication starts there. So foot ulcers most often happens on the ball of the foot or the bottom of the big toe. Or it could be on the side of the foot depending on how poor fitting the shoes are. So these are pictures of how it starts as a callus. And those are the different kinds of calluses and corns and bunions that you can have. So a soft corn starts like it just starts here as a red bump. And usually you will see it after you walk and the shoes keep rubbing on your toe. And then you also have your hammer toes. And those are the common areas where you can have your corns and your calluses. So what are the things that you can do for your foot? One of them is splinting, orthotics, and then you want to wear seamless socks. You want to wear seamless socks so it doesn't restrict your ankle. You don't want those tight ones that would, at the end of the day, you'll have swelling because of the socks. So when you take off your socks, you want to make sure it doesn't leave a mark. If it leaves a mark, then you're wearing something that has some garter in it, and you don't want that. The other things is self-surveillance before and after exercise. So skin inspections, skin dryness and cracking, abrasions and blisters, and these are the common foot deformity that you can have. So one of the things that if you're one of those person that you cannot, I just said you cannot put your head below your waist or you cannot look down. A lot of the things that we have now here is the selfie sticks. It's really, you can see it everywhere. And you can use it to put your, if you can borrow someone's, and you can use it to look for at your foot. Just to make sure that your foot, the bottom of your foot doesn't have any calluses or doesn't have any corn starting. Because that's one of the problems is that we don't feel that it's there. So you want to make sure when you start anything that your foot is clear and the skin is also clear. So these are the protectors, corn protectors that they call, bunion protectors that you can use, bunion aid or post-op socks. The post-op socks is after if you have surgery for your hammer toes. There's the hallux valgus splint. And then how do you get the proper shoes? So what we call therapeutic shoes, you want to have something that has a Velcro or tie strap so it's easy to adjust. If your foot is swollen for that day, you want to make sure you have that little, you can adjust it so it would adapt for your foot for that day. Wide toe box, forgiving material. So the leather and microfiber expands. So that's why there's some shoes that you would try on and said, okay, this one works for me. And then there are other shoes, almost, even if it's the same size, but it doesn't work because it doesn't flex or it doesn't give. So, and if you wear that the whole day, that's gonna affect how your foot will be at the end of the day. And then you want some custom insert, something that would have a good cushion on your heel. If you're on your feet the whole day, if you're walking on that heel the whole day, and you're stepping on that heel the whole time, you want to make sure that heel has a good cushion, has a good cup. And some of them, it could be fitted by professional or extra deep custom insert to cradle your foot. So here it would show you a good example on how a shoe should fit. So this should be how your foot should be. So it has some flexibility, some room for your foot to wiggle. But this one, at the end of the day, especially these toes, that's when you would start the calluses and the corns. It might look prettier than this one, but at the end, when you take off your shoes, it's not going to be as pretty. So these are the shoes, the common shoes that we see. Again, it's not as pretty. What I would recommend for special occasions, if you're going to be out for an hour or two, you can wear your pretty shoes. But if you're going to be doing any exercise and you know you're going to be walking all day, I would recommend that you wear the most comfortable one and the most ones that had good support. So you can put inserts on the shoes. And this is what called inserts. So this one you can put in different shoes that you have. But at the same time, it also depends on what kind of shoes before it would fit. And then you also have the heel cushion. So this one again are inserts that you can, and all of these things you can buy over the counter. Heel cushions. So you can put it in your nice shoes as well. Again, if you're going to be walking on that shoes for the whole day, you want to make sure your heels are protected and the balls of your feet, because that's where most of the pressure are when you start walking. There's the ball of heel cushion. That's how it's used. So how do I get therapeutic shoes? Therapeutic shoes can be paid by Medicare. The three conditions that you need is you have to have diabetes, you have to have at least one of these conditions in one or both feet. You had partial or complete foot amputation, you had past foot ulcers or calluses that lead to foot ulcers, and then there's a nerve damage because of diabetes with signs of problems with calluses, poor circulation, or a deformed foot. And you are being treated by a doctor under a comprehensive diabetes care plan and need therapeutic shoes and or inserts because of diabetes. So when you have the diabetes, the conditions here, it doesn't mean that you have to have all of these. You can just have, if you keep getting calluses and it leads to foot ulcers, and then you are under a doctor's, you have a podiatrist or a doctor that can sign a prescription, and then you have diabetes, you can qualify for a special shoes. So Part B covers foot exam every 6 months with diabetic peripheral neuropathy and the loss of protective sensations. And it also covers therapeutic shoes or inserts for people with diabetes who have severe diabetic foot disease. For shoes or inserts, again, it's the same thing. So this is how you will qualify to get one. So those are the shoes insert. So each one of them, it depends on where the problem is. If you have flat foot, or if you have a low arch or a high arch, those are the ones that you can put in the inserts. The nice thing about the inserts is that you can put it in different shoes. So if you're gonna be wearing your nice day shoes, you can put that in. You can put it in your sneakers as well, or you can put it in your work shoes. And this is how it would really help, that it shows you. So this one has the arch is already gone. But when you put the insert, it helps it align. And so when you have the insert, it helps your balance as well as your walking. It helps your foot when you're walking. The other thing that the challenges for diabetes is what is called peripheral neuropathy. This is actually the most common reason for persons to have ulcers or calluses that become an ulcer. It's because there's nerve damage and there's tingling and pain or weakness in the foot, and it can cause foot deformity. So you don't even know sometimes that you have wound already on your foot because you don't feel it. Or what you have is tingling sensations on the bottom of your foot. And then the skin changes can cause skin to become very dry. It peels and it cracks. And the nerve that controls the oil and moisture doesn't work anymore. So one of the things that they recommend is don't soak the feet. So some people would say, well, since it's so dry and I have calluses, to soften the callus, let me soak my feet. But that's actually not something that you should not be doing, because your nerves are not as sensitive anymore. So when you soak it, it's actually can cause to opening of the skin, and it can cause wound. Don't put moisturizers between toes. It can lead to infection. So every time your foot is wet, you want to make sure it's dry all over. So especially between the toes, you want to make sure it's dry, and not just, oh, I don't feel that it's wet. I feel that it's dry. Make sure you touch it and you wipe and you clean between the toes especially. So this is the stages of a diabetic ulcer. So it can start as an ulcer, as a callus, and then it starts with a little wound and it becomes bigger. And that's why it's very important that you check the bottom of your foot, that you don't miss anything. And the small ulcer can be small on top, but it's actually going down already. The wound is already going down. And it takes longer to heal. So this is the start of a diabetic foot ulcer. So if you see, it's only really small. And sometimes if you have the diabetic neuropathy, you don't even feel it. It doesn't really bother you until it starts getting bigger. So with painful peripheral neuropathy, so some of our patients would say, well, it's really painful, I can't walk on it. So we don't really require that you walk on it. We actually would recommend that you do things that are non-weight bearing, which is meaning you don't bear any weight on it. So when people are walking on that foot, you can actually, some people would do, depending where the wound is that they walk like that. You can start using a walker or a cane, and that's gonna offset the weight on that foot. Okay? So don't put any weight on it if you know that there's a wound there and it's just starting to heal. Because the more you put weight on it, the more you're pushing on that wound and it's not helping to heal. And that's when we try using walker's cane for a short time until it heals. So this is an example of an offloading boot. If a doctor tells you, okay, you're gonna need a special boot for that foot while it's healing. So this takes the pressure off the foot. And this is what's called a cam walker. Again, it's another offloading shoe so that your foot doesn't have to carry all the weight. So one of the things that can happen to complications is it's called peripheral artery disease or peripheral vascular disease. So it's saying listen to your legs. So this one happens higher than your foot, and it affects how the blood vessels on your legs. So the most common area is the iliac artery, the femoral artery, and the popliteal artery. So all those main ones over there, and then those areas can have a plaque and it narrows. And this is the time that you feel the numbness or the tingling, or your leg starts feeling different than the other leg. And you go to your doctor and you say, your foot is starting to discolor. You're starting to have shiny skin and loss of hair on that leg. And it affects the nail growth. So there's a big difference between a diabetes, and that's just starting from the bottom up. This one starts from your artery up, going down. So one of the things that your doctor would do is what we call, they're gonna check your pulses. So they use a sphygmometer, the one that you use for your blood pressure, and then they check if they can detect a pulse. And this is how they do it. So with peripheral arterial disease, you have poor circulation. The diabetes can cause blood vessels of the foot to narrow and harden. So this is how you want your flow to be. So what the doctor would do sometimes is what they call stenting. And they would put a mesh that would allow the circulation to flow again. So depending on where your artery is affected, like the picture before, so if it's in the femoral artery or your popliteal artery, most common actually is the femoral one. So one of the things that we recommend our patients not to sit too long if you are getting some numbness on your legs already. If you're sitting on a chair, you want to make sure when you're sitting, your hip and your knee are the same height. You don't want to be sitting like this. You are kinking that artery over there. And you don't want to be sitting this way. You're going to be hurting your back. So you want to make sure when you're sitting in the chair that you choose, your hip and your knee are on the same angle. Okay? So same thing happens when you're in some people take a long time using the bathroom. So you want to make sure you don't sit there. That's why we would always advocate, if you're not ready to go, don't sit there and just sit there. Try to move around. That usually helps if you have constipation, as opposed to sitting there, again, because you don't want to kink that artery when you're sitting in there so long. So the other thing that can happen is what we call intermittent claudication. So this is the one that you complain to your doctor. You go and walk, and all of a sudden you would have some leg cramping right here. So what happened is that there are blockages in more than one vessel. So there's a plaque here that reduces the blood flow, and now it's blocked. So you'll be walking, and it's gonna start being really painful, and you won't be able to actually walk with it. It's different from cramping. Cramping has some like tingling sensation on the back of your leg, but intermittent claudication, it's really painful. So you would have to stop. Those are the kinds of symptoms that you want to tell your doctor, and that they will do some testing on you before you do anything. Balance problem. That's where we have what I have right now. It might be his inner ear, it says. So with balance problems, it could be caused by your vision. It could be because you have either diabetic retinopathy, or you have glaucoma, or you have cataracts that would affect your balance. Or your proprioception, which can cause by if you have diabetic nephropathy, meaning you don't feel diabetic neuropathy, you don't feel your foot. That can cause balance problems. And then the other one is vestibular, or your inner ear. So there's a blockage in your ear. There's a crystal that's formed there, and it's going to affect your balance. So if you have those balance problems, one of the things that we recommend is the therapeutic balls that you see in the gyms. This would help you exercise on how to improve your balance. Balance usually occurs after everything else that you've had. So I've had patients who would say, it's hard to walk because I don't feel the floor. You're not getting that feedback. So you don't feel if it's cold or it's hot. You don't feel like you're taking a good step. And that's going to affect your balance. Next thing you know, someone would fall. So one of the things that we recommend, if that does happen, so obviously you have to go to your doctor, and then you have to start sometimes using assistive devices. So you have to use your walker or a cane just to help you with your balance. And some of the things that we talk about doesn't mean it's not curable. It's curable. It could be short-term that you use these things. So checking your blood glucose levels before, after, and during exercises. So it's very important when you do any exercises that you check your blood glucose. So generally below 7 is considered good control for your A1C. And you want to make sure when you do any exercise, you have these fast-acting carbohydrates ready for you. So one example is half cup of fruit juice, a glass of non-fat milk, half a regular soda, 1 tablespoon honey or sugar, 5 to 6 hard candies, or 3 to 4 glucose tablets. So those are the things you want to keep in handy when you're doing some exercises, because you would feel if your blood sugar is low, you want to make sure it's handy and you can grab it right away. So carbohydrates should be ingested if glucose level are below 70, and the hypoglycemia is below 70. It can be caused by increased activity, decreased food, or too much medicine. So these are the signs if you're having hypoglycemia. You feel shakiness, dizziness, sweating, hunger, headache, pale skin color, moodiness or behavior changes, clumsy or jerky movements. Well, the seizure is really going to be drastic. Difficulty paying attention or confusion, tingling sensations in the mouth. The most common is actually the first 3 ones, the shakiness, the dizziness, and the sweating. So you're doing your exercise, all of a sudden you feel cold sweat, and you're feeling dizzy, and you're really getting shaky. So those are the times that you would try to see if it can be helped by having a hard candy, or if you're in the gym, if somebody can give you half a cup of orange juice, that's going to put your blood sugar up again. So this is the snacks that you can have. Activity not only decreases blood glucose level immediately by using glucose as energy, it can also decrease blood glucose for hours after being active. So again, that's why we were saying that when you do any exercise, sometimes the effect is after a few hours or the next day, not the same time as you're doing your exercises. So you want to make sure you're hydrating too whenever you do exercises, and you want to make sure you do your exercise before going to bed. When you're doing any insulin injection, you rotate that site and you don't do resistance exercise on that one. So if you inject it on your right hip, you want to avoid doing as much resistance, any challenging exercises for that leg. You want to do the resistance exercise on the other leg. Hyperglycemia is over 300, and ketones are something that you see in your urine, so that's not something you would be able to see right away. But one of the things, the signs are shortness of breath, breath that smells fruity, nausea and vomiting, and a very dry mouth. So the resources that you have here is really good. You have this group, the diabetes support group. You have a wound care clinic around. That's their expertise. You have lymphedema as well for those who have lymphedema problems. You have cardiac rehab. I know that if you have been diagnosed with congestive heart failure, you can go. Medicare would pay for it. And then you have your specialized shoe shops. Right now, actually, the most common and most easy accessible for shoes is online. So, but you want to make sure you have a prescription if you want to be reimbursed, and you want to make sure that you are size appropriate. So what I would do is go to those specialized shops, get size correctly, what's recommended, and then shop online just to check for prices. If you can get something cheaper online as opposed to going to the store, I would probably do that. And that is it.